For 25 years, I've been seeing athletes at Northwest Foot and Ankle. They want to lift weights, they want to run marathons, they want to hike mountains. And I've seen two groups of patient population. I've seen one group, once they learn the information that Chris and I are sharing with them, they never look back. They only ever wear their fashion shoe to maybe the wedding or maybe a special event, but for the most part, they're wearing athletic shoes that are natural and day-to-day shoes that are natural. I have another population of patients who only does this when they're lifting weights, running, hiking, walking, but when they go to work, they might have a workplace dress code or they might feel that the need to fit in. Those people have a whole lot more problems, unfortunately. So one of the points that Chris and I want you guys to take home is once you start seeing the benefits of what this is going to do for your body, you're going to want to do it all day, every day. And if you want your brain to lock into that, it's not a good idea to keep backtracking healthy shoes, unhealthy shoes. So once you get on board, try to make this an all day, every day. Start taking your shoes off a little bit at home at night. When you do have to be in shoes, make sure that your shoes are naturally aligning your feet. It'll be a huge health benefit for you.
So I just want to be clear on one point here, Dr. Ray, because a lot of people may be thinking that we're just talking about foot pain, right? And I know the people, you're actually referred a lot of trouble cases for both back, hip, knee problems that we aren't able to find resolution with versus current clinical models, and you're addressing that through the shoe, right?
Yeah.
So.
Absolutely, Chris. When folks come in, they definitely tell us about the foot pain, as Chris mentioned, but a lot of times they might not necessarily give us more history on the neck or the back or the hip or the knee. And many of them will come back later after their feet get strong and healthy and proclaim joyously that whatever other chronic thing they had has gone away. And to Chris's point, many of them have had huge medical workups. Many of them have had x-rays, MRIs, CAT scans. They've seen a ton of providers, neurology, because the problem is not necessarily with that structure that hurts. And that's a huge take-home piece for athletes. The problem might actually be your foundation and why your foundation isn't allowing the structures up above it to actually do what they're supposed to do.
Thank you, Dr. Ray.
You bet.